Did you know that 1 in 8 couples struggle with infertility, and 50% of the time it's the male partner who's the main contributing factor? I'm Dr. Justin Houman, board certified urologist and male fertility specialist, and I'm here to talk to you about male fertility 101, what makes sense, what doesn't, and what to do next. A lot of times, men don't know that they're the contributing partner when it comes to the couple's infertility issues. And they spend years going on not knowing that they have to get tested. In this video, we're going to talk about all the things about male fertility, myths, truths, and facts, and what to do next when you are experiencing any infertility issues. A lot of men are surprised when they come into my office not knowing that they're the contributing factor when it comes to their couple's infertility struggles. Like I said, about 50% of the time, it's the male factor that's contributing to this. The easiest ways of exploring this are getting a simple test like a semen analysis, which most doctors outside of urology don't necessarily know how to read. What is a semen analysis and what are we looking at? There's a couple things within the semen analysis that we look at. Number one, we look at the volume. We want to make sure that there's at least 1.5 milliliters of semen coming out each time you ejaculate. Number two, we're looking at the concentration. We want to see how much sperm is within each milliliter of that semen. Typically, we want about 18 to 20 million per milliliter. Number three, we're looking at the motility. We're looking about how that sperm is moving, if it's moving in the right direction. We typically want about 40% of the sperm having good motility. And number four, we're looking at the morphology. The morphology, we typically want about 4% of the sperm to look healthy, to look good. Surprisingly, the morphology is probably the least important of these factors that I just described. In addition to that, we're looking at the white blood cell count to see if there's any infection within the semen. We're looking at the pH to see if there's any acid-base issues, which could indicate some form of obstruction. Anywhere from 7.2 to 8 is what we consider normal pH for the semen, and some other factors. Of the semen analysis, the most clinically important factors are the concentration and the motility. When you combine those two, we create what we call the total motile count. We typically want above 40 million or above 20 million. That gives us a good sense of your fertility potential. Anything below 20 to 30 million is when we start to get concerned about other issues that are causing infertility, which would warrant some form of a workup. But the key thing to remember about a semen analysis is it's a screening tool. It's not a verdict. So even if you have one semen analysis that's abnormal, we always tell patients it warrants an additional semen analysis. You want to get another semen analysis anywhere from 3 to 4 weeks afterwards. We want multiple data points because that's just a quick snapshot. Getting additional snapshots 3-4 weeks apart will give us a better complete picture of your fertility potential. What to do next if you are having any abnormalities on your semen analysis? Number one, get a repeat semen analysis. Like I said, the semen analysis is just a screening tool. It's not a final verdict. So repeating that semen analysis 3 to 4 weeks after your first one gives us an additional data point and gives us a sense of where your fertility is trending and what changes necessarily need to be made. Big picture wise, what can you do if you are having abnormal semen analysis a few times in a row? The easiest thing to do is make necessary lifestyle changes. I try to keep it as simple as possible. There's 4 things. You want to eat right, you want to sleep right, you want to exercise, and you want to reduce your stress. When we talk about eating, it's not just going to be good for your fertility, it's good for your heart health and your overall health. You want to mix a combination of healthy carbohydrates, complex carbohydrates primarily, lean proteins, and healthy fats. All of these help contribute to an overall healthy diet, which is good for your fertility potential. When it comes to exercise, you want to mix a combination of cardio as well as heavy weightlifting. I generally recommend at least 2 days of heavy weightlifting combined with at least 2 days of cardio. That mix provides a good healthy amount of exercise and stress on your body to increase your hormone levels, which are very, very key to testosterone production, which is also very important for sperm production and sperm quality. Number 3, sleep. At least 7 hours of sleep. The key thing there is 7 hours of sleep. We've done numerous studies on this, which supports the fact that 7 hours of sleep helps support healthy testosterone levels and healthy hormone levels, which is again very important to sperm production and sperm maturation and health. And finally, when it comes to stress, the same precursor hormone that's involved in stress, the stress hormone cortisol, that's also used in order to make the testosterone. So the more stressed out you are, more of that precursor hormone gets shunted to cortisol versus testosterone. And as a result of that, you have lower testosterone levels, which mean weaker and lower sperm counts, concentration, and health. There's a lot of lifestyle factors that can contribute to male factor infertility as well. Number one, smoking. We know that smoking, any amount of it, decreases your sperm concentration and your motility. And we know those are the two main factors, the two most important factors of a semen analysis. When it comes to alcohol, people always ask this question in terms of what's a safe amount to drink. There's no hard answer on this, but we do know that binge drinking is not good for you. Having more than 5 drinks in a given night can really impact your sperm concentration and your motility. When you try to figure out a safe amount, I try to tell patients no more than 1 to 2 drinks in a given week if you're really trying to play it safe. Whether it's a mixed drink or whether it's wine or a beer, try not to have more than 1 to 2 in a given week. Marijuana use, the data on it is quite conflicting. We still don't know. We do know that a lot of marijuana use can negatively impact your hormone production, again, throwing off the sperm concentration and motility. But at the same time, for a lot of people, marijuana is an aphrodisiac, so therefore they're engaging in more intercourse as a result of their marijuana, which can increase their chances of conceiving naturally. And finally, obesity. We know that obesity is not good for your overall health, let alone your fertility health. What it can do is obviously it can negatively impact your hormone production because the more obese you are, your testosterone gets converted to estrogen, estradiol in the body. And what that does is it can negatively impact the amount of testosterone in the testicles, which is also very important for sperm concentration and motility. Number one, but more importantly, number two, the more obese you are, a lot of times that increases the area, the environment. There's more tissue around your scrotal area, and as a result of that, that increases your testicular temperatures, which is obviously not great because anytime you have more elevated temperatures around the testicles, it could cause damage to not just the way the sperm is produced, but it could cause DNA damage to the sperm. Supplements. A lot of patients ask me about supplements. It's a great topic to talk about, especially these days. We do have some data to support what supplements can do in order to improve male factor infertility. Number one, the most common one is coenzyme Q. Coenzyme Q, we typically tell patients to take at least 300 milligrams every day. This is good for sperm concentration, sperm motility, and the DNA integrity of the sperm. Number two, vitamin C. I try to tell patients to take at least 1,000 milligrams twice a day of vitamin C, as this could help with the DNA integrity of the sperm itself. Vitamin E is also an important one, about 400 milligrams on a daily basis. What this can do is help with sperm motility and again, help stabilize the DNA integrity of the sperm. Zinc. I tell patients to take at least 200 milligrams of zinc on a daily basis, as this can reduce the oxidative stress on the sperm and maintain good DNA integrity of that sperm. And finally, L-carnitine, 3 grams on a daily basis, has shown to improve motility rates as increased chances of natural conception in patients who are experiencing male factor infertility. Let's say you've made all the lifestyle changes to improve your male factor infertility, but you still have issues with your semen analysis. At that point, it requires some form of medical intervention, or at least seeing a reproductive urologist like myself, who could do a further workup into this. What does that workup entail? Number one, a repeat semen analysis to get a new baseline of where you're at. That gives us good information of where you're at currently. Number two, a hormone analysis. We look at your total testosterone levels. We look at your free testosterone levels, your estradiol levels, luteinizing hormone, follicle stimulating hormone, and prolactin levels, as well as some of the thyroid hormones that are all involved in the interplay of male factor infertility. When we look at this, it gives us a sense of where your current status quo with your hormones are, and what we can do to optimize your hormones, which can only improve your sperm counts, concentration, motility, and morphology. And finally, the physical exam, which is probably the most important part. As part of the physical exam, we're looking for a number of things. Number one, we're looking at the reproductive organs and making sure the anatomy is okay. Making sure a patient has the vas deferens, which is the tube that we cut when a patient gets a vasectomy. That's very important because as it carries sperm from the testicle to the outside environment. Number two, and probably the most important part here, is we're looking for a varicocele. A varicocele impacts about 40% of men who are experiencing male factor infertility. And many men don't even know they have a varicocele because a lot of times it's the type of thing that you don't feel, you don't sense, or you don't have any idea that you actually have it. What is a varicocele? As many of us know what varicose veins are of the legs, a varicocele is varicose veins of the testicles. The reason that's a problem is because the testicles like to live in a very narrow temperature range. And the scrotum itself plays like the role of a thermostat. The scrotum relaxes and contracts in order to keep the testicles within that narrow temperature range. When a varicocele is present, there's blood that pools around the testicle as a result of that raising the testicular temperature. And what that does is it causes damage to the way the sperm is produced as well as the DNA integrity of the sperm. So it's a very important thing that we do the physical exam in order to make sure you don't have a varicocele, because if you do, it's one of the easiest correctable ways to fix and address male factor infertility. Once you see your reproductive urologist and you go over your semen analysis, your hormones, and your physical exam, at that point a diagnosis can be made in order to see what's going on. And at that point we can make the necessary adjustments, whether it's your hormone levels, improving your testosterone levels, optimizing those, which can help with sperm health, or even correcting your varicocele if you do have one. All of these are meant to improve your semen parameters and improve your pregnancy rates. Having said this, male factor infertility is more common than you think. As I said, about 50% of couples, it's the main factor and responsible for the couple's infertility struggles. Because of that, it requires early intervention and, more importantly, to be screened earlier. If you are a couple struggling with infertility and you don't know what's going on quite yet, you don't need to wait a year before you get evaluated. The earlier you get evaluated, the better. I always tell patients that if you're struggling for anywhere from 3 to 4 months, have the male partner do a semen analysis, whether you do it at home or you come into our clinic, do a semen analysis, see what your baseline is. If there's anything abnormal, repeat it in a month. At that point, we have a good baseline of what's going on with your fertility potential. At that point, make the necessary lifestyle changes. You could add some supplements, be seen by a reproductive urologist to assess your hormones, to do a physical exam to make sure you don't have a varicocele or any other abnormality. We could then make a decision for what's the best treatment for you going forward. Male fertility issues can be scary, but remember, as reproductive urologists, we deal with this on a daily basis and we can help you in more ways than you can think. Remember, fertility is dynamic, and most men, if they take the right steps, can improve their fertility potential and become fathers. I'm Dr. Justin Houman. Follow for more evidence-based ways of improving your male fertility and your overall men's health.